One of the most common infections in hospital is hospital-acquired pneumonia, but there hasn't really been much work done to look at how we can prevent it. One of the ways in which we think we can prevent this type of pneumonia is to improve oral care, essentially brushing your teeth, or having someone help you brush your teeth if you can't do that in hospital. When you go to hospital, your mouth can become colonised or saturated with hospital pathogens quite quickly. And when you're in hospital, sometimes your swallowing isn't as good as it normally is, mainly because you might be sitting in bed, you might be lying down, you're not moving around as much, and you're also having lots of treatment. And so if your mouth becomes colonised or has these pathogens in your mouth and you're not quite swallowing properly, you can inhale some of these pathogens into your respiratory tract. And that's one of the main causes of pneumonia. So we think that improving oral care is something that could help reduce pneumonia. And this has been shown in smaller studies in the past to show some benefit, but not in a really large, big trial in hospitals. So we undertook a randomised controlled trial in 3 Australian hospitals. This is the biggest, largest, most robust trial of its kind ever undertaken in the world. And we wanted to see whether improving oral care could reduce the risk of pneumonia in patients in hospital. Patients, when they go to hospital, often don't go in with a toothbrush and toothpaste. And often it's not the first thing that clinicians think about when someone gets into hospital either. So we provided this pack to people going into hospital, as well as information about how to brush their teeth and why it's important. We gave them access to resources they could look at in their own time via a website. And those resources were patient-focused, and they looked and were developed by our consumer advisory group, so patients themselves who've been in hospitals. We also provided some education and training to nurses on the ward, and they also had access to resources so they could learn a little bit more about the importance of oral care, how to do it, particularly in difficult situations or there might be a complicated clinical scenario going on. Through that process, we improved the frequency and quality of oral care in our trial. And what we found in this study was that improving oral care significantly reduced the risk of pneumonia by, in fact, about 60%. So a massive reduction in the risk of acquiring pneumonia simply by brushing your teeth frequently in hospital. And we mean frequently, just once to twice a day. So this trial showed some major reductions in hospital-acquired pneumonia simply by brushing your teeth in hospital. So this little simple intervention of having resources available for staff, having products readily available for patients to use, can really help reduce the risk of one of the most common infections in hospital. People who get this type of infection in hospital often end up in intensive care. So if you get this infection in hospital, you're about 8 times more likely to end up in intensive care compared to if you didn't have this infection. This intervention is going to save lives. It's going to prevent admissions to ICU, intensive care units, and it's going to create a safer environment for patients to be cared in hospitals right across the world.